Let's assume you're aware of some symptoms like snoring, nighttime wakings, and daytime tiredness, and you suspect it might be linked to sleep apnea. Well, the next step is to get a sleep study done to find out for sure. But now you're faced with a choice between either getting it done in a lab or ordering an at-home sleep study like the one I have here. Which is best? Well, in this video, I'm going to inform you of the pros and cons of each choice. Sleep studies of both varieties are conducted while you sleep and measure important data related to your sleeping habits. This data is then analyzed by a health professional who can then, hopefully, diagnose whether or not you have a sleeping disorder and then, if appropriate, prescribe the treatment that's necessary. This is the first step to getting a prescription for sleep treatments such as CPAP therapy. These tests are not at all painful, but they do require you to wear monitoring equipment. If you are getting the sleep study done through your insurance, you should first check that they're willing to cover a lab study, as many will only cover one after an in-home study has already been conducted and the results suggest further study is required. Also, lab sleep studies require a referral from your doctor and may have a long wait list. And even once you've completed the study, the data can take a while for it to be analyzed. So if urgency is key, go with an at-home sleep study. But let's suppose that you do have a choice between these options. Which one's right for you? Well, it all comes down to three main factors, all in fact starting with a C: comprehensiveness, comfort, and cost. In terms of comprehensiveness, a lab study wins hands down. At-home studies monitor the most important data for diagnosing the most common form of sleep apnea, obstructive sleep apnea. These are airflow, sleeping position, heart rate, and blood oxygen levels. But lab studies measure far more categories than that, including blood pressure, CO2 levels, and most importantly, for less common forms of sleep apnea like central sleep apnea, brain activity. Because of the extra data provided by lab tests, they're more appropriate for those suffering with more severe symptoms associated with sleeping disorders, or for those that suspect that they have brain-related conditions like central or mixed sleep apnea. But if your symptoms are moderate or mild, an at-home study is usually fine. Lab studies can also be more accurate in their data collection, since a lab technician will be observing you while you sleep and can account for periods of wakefulness when calculating the results. This helps to avoid the underestimation that can occur with at-home studies, and so it's better at ruling out apnea as a cause of your symptoms. For comfort, however, well, you just can't beat sleeping in your own bed, so an at-home sleep test wins here hands down. Lab tests are not done in hospital beds at least anymore, but places that look more like hotel rooms. But nothing beats sleeping in your own bed, and who wants to sleep knowing that someone is going to be up watching and analyzing them all night? It's a bit weird, huh? In addition, that extra data collection in the lab means more equipment attached to your body, including skull attachments to measure your brain activity. So all in all, an at-home sleep study is more comfortable for sure. And as for cost, as you may have guessed, doing the study at home on your own is far less expensive than doing it in a lab run by medical staff. The process is easy and they only require a disposable study kit, a smartphone, and an internet connection. As for hard numbers, well, things can vary wildly depending on your insurance, your location, and many other factors. But for any lab study, expect to pay between $600 and $5,000 per night, with the average currently being around $3,000. Whereas an at-home study kit that we offer at RespShop, the WatchPat 1, can be bought from us for about $200. That's a big difference. And as with anything CPAP related, there are no clear answers about which is better. There are reasons for each, but as a rough guide, if your symptoms are not severe and there is no reason to suspect anything brain related, then an at-home sleep study is more comfortable, more convenient, and far more cost effective than a lab study is. And you can pick one up at the link in the description. I hope that helps, but bye for now and sleep